6 exercises for abductor weakness with Dr. Noah Volz. So the abductor is located on the lateral hip, and it's composed of 2 muscles primarily, which are the glute medius and the glute minimus. The IT band also gets involved here. And when those muscles aren't strong, it can lead to a lot of different types of conditions. But the biggest one of concern is low back pain. So as mentioned previously, the 3 components of the lateral hip are the glute medius muscle, the glute minimus muscle, and the IT band. And so both glute muscles come off of the lateral hip and attach onto the femur. And the IT band is a long portion of connective tissue that also originates at the same location as the glute muscles, but attaches to the outside of the knee. So sometimes when there's weakness in this area, it can also affect the knee. When talking about pain, it's important to recognize that pain is not only a physical phenomenon. And so your mental state, your emotion, there's a lot of other contributors, stress, that lead to whether you'll experience pain or not. So it's important to take all of those into account when addressing abductor weakness. It's also important to recognize that although things are rarely correlated to abductor weakness, there are some glute tendinopathy imaging findings with ultrasound that could be correlated. There's plenty of people that don't have any imaging abnormalities and do have pain, and vice versa. And so we have to remember that imaging abnormalities are actually normal. All of us are asymmetrical. All of us have these abnormal findings on imaging, and really the goal here is to get rid of the pain. So when diagnosing your weakness, there are some orthopedic tests that are utilized. This is not a substitute for a diagnosis, but the tests we most often use in the clinic are the Trendelenburg test, the Q-angle test, hip abduction manual muscle testing, and the single leg squat. It's going to give us a good sense of the health of the abductor muscles. So as we go through these 6 exercises, it's important to look at how to perform these exercises. And so there's 5 things to keep in mind as you're performing the exercises. First is being aware, distracted, really stay in your body, feel what's going on. Breathing deeply can really help with this. Also, even though we're focused on the lateral hip, all of these exercises are going to engage the entire body, and so you want to stay engaged through the entire body as you do these. You want to push yourself, but not too hard, and you also want to be careful, so don't do anything that doesn't feel right. So the phase 1 exercises for abductor weakness are the posterior lunge, clamshells with a band, and the side bridge. The phase 2 side plank with abduction, the monster walk, and the monster circles. So the phase 1 exercises are easier and the phase 2 exercises are slightly more challenging. You can do all of them, or you can start with phase 1. It really just depends on how weak the abductor muscles are. So beginning with the backward lunge, you're in a standing position, and then you're stepping one leg back about 3 feet, coming down so that the knee either hovers just above the floor or gently touches the floor, and then stepping that leg forward and doing the opposite leg. In this picture, she has weights in her hands. That's not necessary. This is a great exercise to strengthen the abductor muscles. Clamshells. So you're laying on your side. You can use your arm or a pillow to support your head. The knees are bent. Try and have the ankles in line with the hips. There's a band around the upper thighs or the knees. And so as you separate the knees, bringing the top knee up towards the sky, it creates resistance in the band. You can hold this at the top, or you can do reps in this position. This is the clamshells with band directions. Then there's the side bridge. There's a modification of this where you come up onto the knees, but in this exercise, we're recommending that you come up onto the sides of the foot and the forearm. So again, you're on your side, you're on your forearm, you press into your feet gently and you lift your hips. You're holding this here or doing reps. So now going into the phase 2 exercises. So I just described the side plank. The difference here in the side plank with abduction is you're lifting the top leg up towards the sky as high as is comfortable. This one will usually get a strong sensation through those lateral hip stabilizers, the glute min and the glute medius. You may also have some challenges with balance, and so this is a good exercise to do once you've really gotten strong with your side plank. The next one is this one. Again, you're going to need a band. You want to take that band and place it around the upper thighs, just above the knee. And so then you're going to separate the feet so there's some resistance, some tension in that band. And then you'll separate the feet even wider as if you're stepping out to the side. And then you'll follow with the opposite leg, and you'll just keep stepping to the side with that resistance, again, feeling that gentle engagement through the outside of the hip. The next one is monster circles. Do this. The really important part while doing this is to pause and move slow as you're doing the exercise. And you're basically just wanting to bring both legs in all the different ranges of motion. So bringing the leg forward, bringing the leg out to the side, and bringing the leg back behind you. So you can do this as a walk, or you can just focus on one leg at a time. So I'll describe doing one leg at a time. So you'll wrap the band just above the ankles. You'll separate the feet so there's tension in the band. And then let's take your right foot forward, nice and slow, back to neutral. Step the right foot off to the side, then back to neutral. Step the right foot back behind you, and then back to neutral, and then switch sides with the other foot. Well, that's the basic gist of the monster circle. So in terms of reps and sets, oftentimes it's recommended to do 3 sets of 10 reps of each of these. That can be good for most people, but you really want to focus on how much effort you're using. So you want to use at least 60 to 80% of the effort. But you don't want to do more than that because you don't want to overdo it. That can set you back, especially in the early stages. Also, you may find that some of these exercises are really easy for you. Some of them are really challenging for you. So you want to vary the exercises so that they're the right amount of effort for you. What somebody like me or a personal trainer or a strength and conditioning coach can help you to find the right type of exercise that's going to help you adapt as quickly as possible and get strong so that this is no longer a challenge for you. So that's really the benefit of working with a practitioner, is that they can customize and personalize the exercises for you so they can find the hardest thing that you do well so that you can adapt quickly. That adaptation is really important when doing these type of exercises. So my approach is we reset the system, we reinforce the new patterns, and then we retrain even better patterns. So this is part of retraining. This is after we've assessed that the abductors need some support. Oftentimes in the clinic, we'll do massage on those abductors. We may adjust the pelvis or adjust the knee or adjust the low back in order to reset the system and create a window of opportunity. There may be some suggestions in terms of posture, sleep, or stress management, because all of that contributes to your success and to the resolution of the pain that is caused by this condition. So as always, the best way to get results is to schedule. Then you really get that personalized and customized, but hopefully these exercises are beneficial for you. If they're going to work for you, you'll get results within the first 7 days. If they're not exercises for you, then you may want to work with a healthcare provider to get the right exercises. So thank you so much for listening, for your attention. I hope that you found this useful, and I look forward to working with you in the future.